In the next 45 minutes or so, we're going to be talking about the new look of the emergency department at GBMC, what you can expect if you have to go, what the procedures might be, particularly in light of COVID-19. And just as we all face this winter season, and a season where in most cases, flu spikes, cold spike, we're in closer proximity to each other, we're not outside as much, and so we're very concerned about getting sick. And then what do? It's good to have sort of a plan in place, know what symptoms you may be having, what may trigger a visit to the emergency department, and be comfortable knowing what that will entail. And so that's what this next 45 minutes is all about. And feel free to write in questions if you're watching us live right now. We'll try and get those on the air as well. And we're kind of switching out with our different experts. And right now, Ariel Leone is going to be joining us, and she's going to be really giving us a tour of the adult emergency department. And then we're going to be breaking out and talking about pediatrics as well, because it's very different when you're talking about children, and parents really have a whole different set of concerns if they have to bring their children in to the pediatrics emergency room. So first of all, Ariel Leone joining us now. Thank you so much for being with us.
Hi, how's it going?
It's going great, thank you. And you're really joining us to talk about what sort of the new look and new procedures are when it comes to adults coming into the emergency department at GBMC. So it's kind of nice to have something new and positive to say about it when we've all been in the trenches dealing with the pandemic, and now we can say, okay, we have some new systems in place, we have some new spacing of our waiting room, and we're ready to go in case you're needed. So what can you tell us about how it is now?
So we did do a lot of changes when COVID started, specifically more so with the social distancing. So as soon as you come through the doors, you'll notice the floor markings on where we would like patients to stand. Our security team is there, but they're behind a plexiglass. That's just for their protection. And we do have little waiting areas that also have plexiglass up there with the registration and the first triage nurse that you'll meet. And that's also just to keep everybody divided as much as possible and promote social distancing. But you'll come in, you'll get triaged and registered just like you normally would. We're going to go into the triage room, get your vitals, get a set of blood work if needed. And we'll kind of start your care from there. The goal is to be proactive and try to limit the amount of time that you actually have to be here in the hospital. So you'll notice that you may be in the waiting room and you may be taken to a test from the waiting area. And you may even get your results back while you're in the waiting area. We do have a new RAS area that we're using as well. So for patients that just need to be quickly seen and discharged, we're using those as well. So it's just a whole new technique, and I guess area and everything that we're using to try to make your time is more efficient, and you don't have to spend as much time here as possible. So,
and it's been a while since I've been in an emergency department, but I'm getting the sense that gone are the days where you're all kind of sitting around next to each other with various symptoms. Not that was, it just,
True.
Some days were really crowded, right? Or some days
Right.
you would go in and you just had a lot of people. What are you going to do?
Right.
But you're kind of moving, it's about moving them on as quickly as possible to where people need to be.
Correct. Yeah, absolutely. Trying to do it as safely as possible. For those that are coming in that are really, really sick, we're not even triaging you in the room. We're going to go ahead and take you back to a room immediately. And we'll start the triage and registration from back there, just to limit the amount of exposure to everyone and to start your care as soon as possible to get you feeling better. So. And
how can you determine really, really sick immediately? Is it that just taking the temperature really quick and sort of getting the symptoms?
Yeah, a little bit. As a nurse, you kind of have that gut instinct. So as soon as somebody comes through the door, you're kind of already assessing them. We're not even talking to you, but we're looking at you. We're looking at how you're breathing. We're looking at, are you sweaty? Anything abnormal, we're already judging just from the time you hit that front door. If we do get the chance to go ahead and do vital signs, if anything is abnormal at that time, then yes, that will make you a priority. But for some patients, we don't even get to get the vital signs on them. It's just looking at them and just something doesn't look right and kind of going with that gut instinct and acting on that right away.
Yeah. And Ariel, I would imagine you're feeling much more confident in procedures and where we are with COVID than maybe you were in March, when it was a complete unknown when someone would walk through the door what that meant.
Right. I do agree. I wouldn't say confident so much as I would say more used to, because you do get like a little wrench thrown in your plans every once in a while. But I will say the teamwork has been amazing between everybody just kind of getting together and getting the job done, regardless if it's your patient or whoever's patient. We kind of are just all working together just to keep everybody safe. It was very scary in the beginning. Nobody knew what to expect. So we are able to catch those signs and symptoms a little quicker now than we were before. So confident, I don't know if that's the right word, but definitely a little bit easier.
Yeah, I guess
like
you
said,
don't want to
always
be
changing.
You don't want to be too confident or too comfortable
Right.
because you let your guard down, right?
Exactly.
How many visitors are allowed now with a patient either coming in or coming in afterwards with the new rules in place?
Right. So in the emergency department right now, we are not having visitors. This is something that changes. It's very fluid down there. So we're just keeping, I guess, up to date with our incident team, the incident command team, and what CDC says. But as of right now in the emergency department, there is no visitors unless there's different circumstances. So if you have someone like the developmentally disabled that aren't able to advocate for themselves or even speak, there's a certain criteria that has to be met in order for someone to be able to have a visitor with them. And it's not because we don't want their family members or friends or whoever to keep them, to be with them, to give them that kind of that secure feeling. Because of course we all want that when we come to the emergency department, but it's just to try to keep everybody safe and limit the amount of exposure to the visitors. Now, I know on the inpatient side, they are able to have visitors. The hours, I believe, is from 1 to 6, and it's one visitor per day. So they're not able to switch it out. But Lauren is going to come in after me, and then PEDS is a little bit different how they're doing visitors.
Oh, I'm sure. What if, as an adult, and we'll stick with the adults right now before we get to children, but what if someone has, I didn't drive myself, let's say my husband drove me in, can he come in with me?
So we've been letting family members, if the husband did come with you, they would be able to be with you while you're being triaged, provided that that's able to happen, that you're not being pushed completely back to a private room. But they would be able to stay with you while we're getting the story, getting the blood work and the initial vital signs. However, they would not be able to go with you to the waiting room, and they would not be able to go with you unless you met that special criteria back into one of the emergency department rooms. At that time, I'm sorry.
No. Are you still finding people as a nurse coming in and saying, I waited so long to come here. I wish I didn't wait so long, but I was really nervous about the virus and I didn't want to expose myself, or are they feeling more comfortable now to kind of get on it sooner, or what are you seeing? This is purely anecdotal, obviously.
Yeah, I think it's a mix. Some people are still holding out, which we would prefer that you don't, or at least try to get in touch with your provider, your primary care provider, and see if they're able to get you in for a virtual visit, if not an inpatient, an office visit, or even go to one of the urgent cares, even if you just want to stop by and just make sure that, it's not life-threatening. But if you are having any type of life-threatening symptoms or something just feels off, that's our job to figure out what's going on. Try not to self-diagnose yourself. Just come in, let us take a look at you. The worst we say is everything's okay. And you get to go home with a clear peace of mind. But the one thing I did want to say about the family members, we have a card that has like the number for the hospital on there. We do have iPads. There's other ways that we can get in touch with them. We are proactively, as nursing staff, reaching out to family members within that 2 to 4 hour window from when they first arrive to provide people with updates on lab results and tests and things like that.
You had mentioned virtual medicine. Is there a way now to call ahead or use telehealth to the emergency department to determine whether or not I should come in or not?
So there is, I believe it's either on our website or in the My Chart. You can go in and let us know ahead of time that you are coming. It's not an appointment, but it does give us a heads up as to what your ailments are, like what your signs and symptoms are, and it kind of gets the ball rolling on your care. However, if you do put in a certain sign or symptom and it flags it as being like a life-threatening condition, it will advise you to call 911. So that's just another thing to keep in mind. But we love knowing that you're coming ahead of time. It kind of helps us get things ready for you, and then we can kind of move forward with your care from there.
And I get the sense, no matter who I am, if I got in touch with you and I was thinking about coming in, you in the end would probably say, come in anyway and check it. Like you would probably never tell anyone to stay home at that point.
Absolutely not.
Yeah.
Absolutely not.
It's just a matter of, right, it's just a matter of how they get there and how quickly they can get there.
Exactly.
Do you have an average wait time for a patient coming into the emergency department?
We don't necessarily have an average wait time. We do have like goals that we try to meet to get patients seen. But if you mean like in the waiting room, it varies. We're always trying to come up with new ways, like I said, seeing patients in the RAS room or in our throughput rooms, and starting that blood work and getting those tests done while they're in the waiting room kind of just helps us facilitate a quicker visit for everyone and becoming a little bit more efficient. So to say that, do we have an average wait time? It varies by the day, honestly.
I have actually called emergency departments and asked how busy they are to make a choice. And I really couldn't get a straight answer, but I've made that attempt. I know that sometimes, excuse me, sometimes it's hard if you need to be admitted into the hospital. Sometimes there's a lack of beds, or it's particularly crowded in one area or another. What happens if I have to stay overnight in the emergency department? Again, the question about, can someone be with me, or what's the situation with that?
All right. So once you're admitted, we will have an inpatient physician come down and talk with you. This is kind of when they build their care as to what will happen when you become that inpatient patient. And before you get to your room, they like to go over all the orders and medications and things like that. So I always tell people during that time, please ask any questions that you have and any concerns, just because this is kind of planning your care at this point. During that time frame, again, we still are unable to have visitors because it is a no visitation in the emergency department, with the exception of either crisis or if you meet that certain criteria that we talked about. So until they physically get into a room on a unit, they unfortunately would not be able to have a visitor with them, but we can put them on the list. And like I said, between the hours of 1 and 6, they would be able to have that visitor come in. There is a waiting area on the 5th floor. If they would like to go there, there's a Subway, there's like a sandwich shop is up there as well. They're able to get food and kind of just wait it out until they're able to come and see their family member or loved one. Otherwise, they're more than welcome to go home if they'd like to, or wait in their car. But like I said, we would be constantly keeping people updated with any changes and results and things like that.
You know, I have to ask you too, for civilians, I should say those of us not in the healthcare field, we talk about what masks we like better than other masks, and there's all kinds of websites, right? But you're wearing like 16 layers at work for the last 8 months. What kinds of tricks have you learned to make it more comfortable, to expedite the process for yourself? Like, what has that been like?
So I wear 2 masks. I wear an N95. I'm one of the few that does that. Not everybody does it. Everybody does their own thing. But I do an N95 and I do a surgical mask over top of it. And my biggest tip is to learn how to breathe through your nose. So if you like play an instrument or you're a mouth breather or anything like that, you got to learn how to do it through your nose, because otherwise you're going to start feeling lightheaded or dizzy. And it's not as pleasant as if you breathe through your nose. So that's my biggest tip for everyone.
Okay,
it's a weird
great.
one,
And
but it works.
Also, before we let you go, what is your one most favorite thing about the sort of facelift at the emergency department?
It's so much more functional. I mean, not that it wasn't functional before, but it's a lot more greeting. It's a lot more efficient. You're able to get things done in a quicker time, and it's just a better overall experience, I think, for the patient.
All right, excellent. Ariel Leone, again, thank you so much for all you've been doing. We really appreciate you. Just knowing that you're there is amazing. So thanks for joining us today and taking the time.